One, two, three. You have actually two batteries down here. This one is still charging. This one, I'm not sure if it was charged all night long. I don't know. It should turn green. So when you check your code card, make sure it's unplugged. All right. Why do you need to have it unplugged?
So that you can go to the patient's room?
Correct. Okay. Because let's say you have a code in the middle of the hallway and there's
Yeah.
no plugs, you make sure your defibrillator is working. So it's unplugged right now. Turn it on. Okay.
And
Options. Okay.
and then we'll go to user
User
tasks.
tasks. Okay, so that takes like 2 minutes to do. Make sure you have paper.
Mhm.
This one doesn't have paper, so it has a little bit. I don't know if it's gonna print. So, okay. See, it defaults to paddles.
Yeah.
So what do you do to change it?
Put it
Yes.
with the test plug.
I should just,
Oh, it passed
yeah, it
somehow.
passed. Okay. So the test plug thing is actually, this doesn't have it.
That's a paddle, yes.
Right.
Yeah.
It's actually a test plug. You plug it,
Yeah.
looks like this, but this one doesn't have it. This one is actually a real.
Mm-hmm.
So when you go back to your floor, you'll see it. It's in here. It's like a plug. But this one doesn't have it. So when you turn it on and when you connect your patient to the monitor, what do? Because you won't get anything because you're on paddles.
We set this up white right,
All right, so let's see, white, right.
yeah. Black opposite on the left side, and then red underneath the black.
All right, and then this is only 3 leads.
Mm-hmm.
All right, you won't see anything because you're on paddles. So you
Okay.
have to change that to leads. So how do you do that? You can either press this and put it on lead 2.
Okay.
Lead 2 is your most upright lead, okay? Or some monitors don't have this option.
Mm-hmm.
Let's turn it off. See how it defaults to paddles, right?
Yeah.
So if you don't have this option on your LifePack 20, you highlight it,
Mm-hmm.
push it, and change
Oh.
your lead to lead 2.
Okay.
Okay? All right. Let's say, for example, one of your leads is off.
Yeah.
It's frazzled and it's not working. What do? And you don't have any more life pack on the floor. So you can still use this. Remember, this is your paddle. So
paddle.
you will use this instead of the leads to monitor your patient.
Okay.
It's the only time we use this if during an RRT your patient is unresponsive, you put the pads on. If your
Yeah.
patient is awake, alert, still talking to you,
Then we can just use
you
that.
can just use this. But once
Okay.
they start getting unstable and unresponsive, put this on. Okay, so let's just say your patient is bradycardic. Your heart rate is 40. And the patient is telling you, I feel dizzy.
Mm-hmm.
What do you do?
RRT.
Okay, so call an RRT right away.
Yeah.
So it takes like 5 minutes for the people to get to your floor because you're on the other side of the building.
Yeah.
What will you have ready? What do we usually give for sinus bradycardia? Because your patient is symptomatic,
Mhm.
just lightheaded.
Atropine.
Okay, so just make sure you have your atropine ready.
Mm-hmm.
Okay. Will you get it from there, from your code card?
Omnicell.
Okay, get it from your Omnicell first.
Yeah.
Okay, so because once you open the code card,
You have to like have it clean up
correct,
and
and
everything.
then change
Okay.
everything for just one atropine. So,
Yeah.
but if it's a real code situation, then of course you can always
Yeah.
open that thing. But you can get your atropine, have it ready, so by the time
Mm-hmm.
the RT people are on your floor, you can give half,
Mm-hmm.
only half, right?
Okay.
You give half and then check if your patient is responding to half.
Okay.
If the patient is not responding to half, then give the other half. And usually by the the first milligram, the RRT doctor is already, the hospitalist is already there.
Yeah.
If it does not respond to 1 milligram, you can give another 1 milligram. The what is the max for atropine? She did not do ACLS yet. You can give up
1.2?
to 3
Three.
Oh,
milligrams.
3. Okay.
Yeah, you can give up to 3 milligrams. Let's just say your patient went tacky instead, and your patient is having symptoms. Lightheaded.
Yeah.
I feel like my chest is pounding.
So we RT,
Call an RRT. Okay.
and then we'll try vagal maneuvers.
Very good. So always do vagal maneuvers first. Make sure when you call an RRT, your patient is already on the monitor. Because half the time when I respond to RRT, their patient is not even on the monitor.
Yeah.
Okay, so vagal maneuvers, it did not work. As long as you know how to put it on, you call RRT. If, let's say, the doctor is right there, I'm the cardiologist, and this is your patient, and your patient is telling you, I'm short of breath, I'm having chest pain.
Yeah.
If the doctor tells you you don't have to call an RRT, what will you do? What will you
Him, we should.
Correct. So you just tell him, Doctor so-and-so, I need to call an RRT because I need people to help me.
Yeah.
I have 5 other patients.
Yeah.
Because him standing there giving you directions, who's going to help you? No one, right? So if your RRT team is there, you have respiratory checking your airway, you have an ICU nurse who can help you give medication, you have your charge nurse, and you have who else? The hospitalist.
I have a question about the EKG. I heard you need an order for an EKG.
No.
If it's an RRT,
Yeah.
automatic, you have to do an EKG.
What if your patient's symptomatic and you want to check that EKG first before
Get it.
anything?
Get it.
We can just
Get it.
okay.
Yeah.
You can get
That's
the-
part
you get
of
the
your
order later.
RRT responsibility.
Okay.
Get your vital signs, blood sugar, and your EKG. Okay. So, remote room called you, and this is what they saw on the monitor downstairs.
VFib.
That's VFib. What are you gonna do?
We call a code.
No. Go check your patient
Yeah.
first.
Check the patient.
Check your patient first.
And typically with VFib, they're unresponsive.
Correct. They're not awake.
Yeah.
If they're awake, it's not VFib.
Mhm.
Okay. It's probably they're doing something.
What did Saul say?
Okay.
They could be in the bathroom
They could be
doing
in the
what?
bathroom.
brushing their teeth.
Yeah.
Right?
Yeah. Right.
So that's why you want to check the patient.
So your patient is unresponsive. What do you do next?
We call the code.
Okay, so
We-
make
and then
sure
we'll do the
make
CPR.
sure you check for a pulse, your
Yeah.
BLS.
Yeah.
Okay, check your pulse, no pulse, then start your CPR, and then call a code. If
Yeah.
you don't have a pulse, you call a code.
And then check
Okay,
code status.
not an RRT.
Okay.
No pulse is a code.
Yep.
Because sometimes they'll call RRT. The patient, they're already coding the patient. That's not an RRT.
Yeah.
That's a code.
Okay.
Okay. Let's just go back to the Brady. The doctor tells you the atropine did not work. I want to pace the patient. Let's pace the patient.
Transcutaneous.
So, transcutaneous, yeah, external transcutaneous. So what do? Make sure you have this on.
The paddles. Yeah.
Okay. This is on and this is on as well.
Mhm.
Okay. This will deliver your electricity. This will monitor
Yeah.
the patient. Okay. All right. So you turn this on,
The pacer,
right? Okay,
yeah.
turn it on. It's not gonna work because it's just on simulation, but I just want to show you. It's gonna tell you to connect the pads.
Yeah.
Then it's gonna tell you the rate.
So
So the rate is usually 70,
yeah.
and then the current is usually 10 to 20 until you increase it until you see a capture.
Okay.
All right. And then see this pause here. If you want to see what's the underlying rhythm,
Yeah.
you just hit pause, and then it will give you the underlying rhythm without the pacemaker.
Okay.
All right, so that's the pacer. So let's just say your patient is this patient again, this one, and you did cardiac, you did vagal maneuvers, blah blah blah, and the doctor tells you, and this is the cardiologist again, and I'm gonna give you a real example because they do this a lot. Especially you guys, you're in threes, you're not used to seeing all this. All right, cardiologist is at the bedside, and he tells you, get me the adenosine, because the vagal maneuvers did not work. Because to break this, you need adenosine, right? For SVT. So you would say, I need to call RRT. I need people to
Yeah.
help me. Okay, so you call RRT.
Yeah.
Okay, So it's okay if it's there. You can give him the adenosine. The cardiologist is right there in front of you, telling you, "I want you
Okay.
to give adenosine." You call RRT.
Okay.
You have to get the people to help you.
Okay.
Okay. And if he tells you, "Okay, let's do synchronized cardioversion," so you hit this. Okay, make sure you have it. Anytime you're delivering electricity, you have to have this on the chest.
Yeah.
Okay. Make sure it's connected here.
So synchronized would be normally 100 joules, right?
Correct.
Yeah.
Yeah. Well, he tells you energy select. Just give 50 for now. Okay. All right, and then you go charge.
Mm-hmm.
And if your patient is awake and alert, you don't want to zap them when they're awake and alert.
Yes.
If their blood pressure is okay, you can suggest, can we give him some Versed?
Okay. Yeah.
Because you're technically
Shocking
electrocuting
them,
them, right? So you can do all that. Those are emergency situation. I hope it doesn't happen in 3 E's.
Yeah.
But always remember to call an RRT, okay? And if that changes to fib,
Then
what do you
we
do?
check the patient,
Okay,
call a
no
code.
pulse.
Yeah.
You
Call a
now.
code, and
Right.
then we.
Right. So
Yeah,
what do you do here? You're on
defibrillate.
synchronized cardioversion still. You have to turn that
Turn it
off.
off.
Okay, because you cannot do synchronized cardioversion here. You don't
Mhm.
see your P waves.
Yeah.
So you turn it off. And then you go to your charge.
And then like.
Go to 300,
Mm.
right? Charge it and shock.
Okay.
Okay? All right, so you will learn all that when you do your ACLS. I just want you to be more familiar with all the things that you see here. Okay, let's say you have a patient who's having a procedure. You got a Sloan patient who's having shortness of breath, and the patient is on cardism drip.
Mm-hmm.
Okay, the doctor wants you to do a VQ scan. So you're gonna go with your patient, right?
Mm-hmm.
Anytime you have drips, you have to go with your patient.
Yeah.
Anytime they're unstable, if they were an RRT patient within the 24 hours, you have to go with your patient. Okay. I want you to go to the policies, stat and procedure.
Mm-hmm.
Go to criteria for EKG monitored patients during transport. It's
Okay.
all in there. All right. So how do you change that to leads?
It's already in lead, so I just
Hold
press
on, let me
this.
just-
Need to.
Okay, so lead 2. All right.
Yeah.
So let's say you want to hear the volume.
Mm-hmm.
Right now, the volume is off. So even if you're on, let's say your patient is on a stretcher, and you can't see it, but
Yeah.
you can hear. I always turn the volume on,
Okay.
especially if I can see the
How do we get to
monitor.
the volume again?
So this is what you do. You go back to the home.
Home.
All right, so just highlight it,
Yeah.
highlight everything,
And then just press
yeah,
this.
press it, and
And then I
Press
click
it
on this,
again,
and then I
yeah.
could.
yeah.
Okay.
All right, and then if you don't want it too loud, you can decrease it. All right, so at least even if you don't see it, you could hear.
Mm-hmm.
So what does sinus brady sound like?
Slow.
Once you become really familiar with the sound, so what does that sound like? Oh, right?
Yeah.
It's really slow. So even if you don't see it, you know you're slow. Some life pack have the O2 sac.
Where would
All
the
right.
O2 reflect over
Here.
here, like the pulse? Okay.
You'll see it down here. This is your code summary,
Mm-hmm.
but the only time you will get a code summary is if you remember to turn it on. So if you don't remember to turn it on,
So turning it on simply is just pressing on the button,
Right.
and that's it.
that's not a lot of people use this anymore. Years and years ago, we used to.
Is it because tele people downstairs, like if they have a tele pack, they take a record of it instead?
Right, because we have a record, we have a paper anyway. And sometimes if you're in a code situation, you're like rushing. You don't remember how to turn on all those buttons. So these are just extra features.
Okay.
Let's say you gave a medication, you can print that strip
Mm-hmm.
from here. Let's say you gave atropine, and your heart rate, this is your baseline. You can print that, and then if you got a response from the atropine, you can print it again.